to me, it's, all the research that comes out is conclusive that plant-based diets are the best diet for health. And I mean, in 2015, processed meat was labelled as class 1 carcinogen, and that means that it is cancer causing. It's in the same bracket as cigarettes, yet there are no health warnings on processed meats like there are on cigarettes. So it's people, and many people aren't aware of it. They just don't know. And I think we're failing people and failing their health not to warn them. And we've had so many patients come through on plant-based health online who were not plant-based when they came to us, but are now completely whole food plant-based, and they've noticed huge improvements in their health. Their blood pressures have reduced significantly, their cholesterol has come down. We've had patients who have put their type 2 diabetes into remission with a plant-based diet.
Hey everyone, this is Andrew from Creating a Vegan World, and in this interview I spoke to Lisa Simon, who is a registered dietitian based out of the United Kingdom, that talked about finding the right nutritional advice when you switch to a vegan, whole foods, plant-based diet. So there's a lot of information out there from people who are Instagram influencers, YouTubers, bodybuilders, and they might even be a nutritionist who doesn't have all the information, such as a registered dietitian or a plant-based medical doctor. So really insightful interview, learning more about what nutrition to take when you want to improve your eating habits. So I'm looking forward to sharing this interview with you.
Yeah, so I've been a dietitian I qualified in 2014, and I worked for the NHS during that time. And I still work for the NHS now. I do a weekly gastro clinic. So I specialised in gastro 5 years ago. But I left my full-time post at the end of 2019 to focus more on freelance work. And it was around that time I got into plant-based nutrition. So I got into it when I was going through fertility treatment myself through IVF. And we now have a 2-year-old as a result of that. But I decided to specialise in plant-based nutrition, specifically in optimising male and female fertility, as well as gastroenterology. So I work for Plant-Based Health Online currently, so that's the majority of my work. And we're the first CQC registered UK online plant-based health company, so it's really exciting.
That's great. So what type of work do you do specifically? Is it like Zoom calls with clients where you tell them what types of foods to eat, what to cut out, and things like that?
Well, we're fully online, so we use a platform called HeyDoc. And we see patients with a variety of conditions. So they could have chronic health conditions. They might just want to transition to a more plant-based diet, and they just need some help and evidence-based advice. And we give practical advice as well. But we're a lifestyle medicine company. So we don't just focus on diet, we focus on all the other pillars of lifestyle medicine. So getting restorative sleep, looking at stress management techniques, physical activity, personal relationships, and the avoidance of toxic substances, so including alcohol.
That's great. And I think I mentioned by email, where pretty much framing up this interview, I just interviewed Dr. Esselstyn about plant-based diets, how he reverses heart disease and lowers cholesterol. And one of the things he said mainly is in medical schools, they don't have enough nutrition education as he sees fit. And I did some research after, where it's only maybe like 25 hours. So as part of my Creating a Vegan World documentary and YouTube channel, I just want to get the word out there to see like what nutritionists and dietitians are doing to help make sure people know what to eat. Because from my personal experience, I forgot if I told you, I went to a GP, I had high cholesterol, triglycerides, and his solution was hand me a prescription medication. And he didn't give me any advice about my diet, my exercise. I had to turn to Google. And of course, there's good information on Google, and of course, there's misleading. So looks like your profession.
A lot of misleading information out there. Yeah.
Definitely.
Yeah. And it's difficult because I suppose when you go and see your doctor and when you see your GP here, you only have a 10-minute slot, and there's no time to discuss anything in depth in 10 minutes. But as dietitians, we're in the prime position to educate people on sustainable diets, and not just for health but for the environment as well. But even when I was in university, that I don't remember there being any classes on plant-based diets or sustainable diets, and we were taught very much that meat and dairy are the best sources of protein and calcium and various other nutrients. And when you look at the diet sheets that are given to patients in hospitals, the main focus is on for patients who need to gain weight, because the majority of patients that we see in hospitals are for weight gain rather than helping them to lose weight, is fortifying food with cheese and cream and whole milk and all those sorts of foods, so that there was very little emphasis on plant-based sources of these things. But I think things are changing, and there's so many passionate people out there who are promoting the plant-based message that it's going to be a long process, I think, but we are getting there.
That's amazing. Yeah, I've been vegan for close to 4 years, and mostly junk food vegan, transitioning to more whole foods plant-based. And I think one of the questions I want to ask you is, you kind of touched upon this when we were emailing, is there an ideal diet for people? And you said certain people with like IBS, they can't take a certain type of whole foods plant-based diet right away. So is there like an ideal diet, or how's it individualized, things like that?
So for my gastro patients, it's very different to the advice you give for the general population who don't have any underlying problems. So with IBS and most gastro conditions are because you have a less diverse, less healthy gut microbiome. So you have to go slowly, and a whole food plant-based diet is completely achievable with IBS and inflammatory bowel disease, but you need to do it very carefully, and you don't just suddenly go from having very little fibre in your diet to packing in 30 grams of fibre a day, as the general recommendations are. You have to go slowly, and with inflammatory bowel disease, it very much depends as well whether you're in flare-up or whether you're in remission, because when you're in flare-up, you have to follow a low fibre diet because you have to rest your bowel. And if you suddenly throw in a load of fibre, you're going to cause yourself possible blockages and strictures, and those can be life-threatening. So it has to be done under the supervision of a dietitian in those situations. But for the general population, whole food plant-based diet is the best diet for health. It's full of nutrients, it's full of fibre, phytochemicals, antioxidants, all the food groups there. And I think what people don't realise is that it's not what you call a diet. It's not an exclusion diet. It's actually inclusion. It's including as many different foods, whole foods as you can. And that, there's no deprivation there. You don't feel like you're missing out on anything. And the focus, I don't focus on weight loss when you look at adopting a whole food plant-based diet, because I think that's damaging. It's not conducive to health. It's about eating as much as you want, and it's very hard to overeat on this kind of a diet because it's so full of fibre, and it causes you to be full, and you're never hungry on this kind of a diet.
Absolutely. And I know there's a lot of fears when people transition about not getting enough adequate nutrition. So there's the big ones like protein, omega-3s, iron, zinc, things like that. Can you talk about that? Can you get adequate nutrition? I know doctors recommend B12 supplements, and outside of that, anything else?
Yeah, I mean, you have to have a B12 supplement because there aren't adequate sources of B12 on a plant-based diet. But it's a common misconception that you will put yourself at nutrient deficiency, and I've had it said to me many, many times, and by healthcare professionals as well, that I'll be deficient in iron and omega-3 and calcium and various other nutrients. But actually, vegetarians and vegans have not been shown to have to be more at risk of iron deficiency than any other meat eaters or any other diet patterns. They have been shown to have lower iron reserves, but actually that's a positive thing. And there was a meta-analysis, a systematic review, I think 2012, that looked at the harmful effects of having too much iron in your diet. And with heme iron, which is the iron in animal products, you absorb it much better than non-heme iron, but actually you absorb it too much. And once your body has absorbed the iron, it has limited capacity to excrete it. And heme iron is pro-inflammatory. So it causes oxidative stress in the body, which leads to inflammation, and that damages cells and DNA. Whereas with non-heme iron, our bodies are really clever at regulating how much we absorb. So if our iron reserves are low, then we absorb more non-heme iron. If our iron reserves are plentiful, then we don't absorb as much. So it's really clever, and it doesn't do that with heme iron. So the best source of iron is via vegetarians and vegan diets. And actually some of the studies in the review found a link between too much iron and an increased risk of type 2 diabetes. So I would always say, get your iron from vegetarian sources, but you have to be aware as well that iron deficiency anemia is the most common nutritional deficiency in the world amongst any food eaters. And you need to be aware that with non-heme iron, there are certain things that can reduce absorption. So you just need to avoid having tea and coffee with your meals, alcohol, calcium as well. So if you're on calcium supplements, then don't have them at the same time as your meals, and just put lots of vitamin C foods with your meals to help you absorb this as well. So for your breakfast, if you're having porridge, pile on the berries on top, or have lots of different colourful fruit and vegetables with your other meals as well. And with omega-3, as you were saying, it's funny because the source of omega-3 is algae, and that's why fish, and oily fish especially, have are such good sources of omega-3. But when you're eating fish, you're having microplastics, you're having all the pollutants that are in the seas and the oceans, and they're getting worse. And we know that omega-3 is important for health. We know it's important for brain health. And there was a meta-analysis last year, actually, that looked at 13 randomized controlled trials. And they found that omega-3s have a role in primary prevention as well as secondary prevention of cardiovascular disease. So you can get omega-3s in the diet, in a plant-based diet. So you get them in the form of ALA, which is the parent omega-3, and then your body converts it into EPA and DHA, which are the important omega-3s. And you can have chia seeds, flax seeds, hemp seeds, walnuts. They're the most commonly known sources. But personally, I recommend a supplement as well, because you can't rely solely on the food sources. And the main reason is if your diet is high in omega-6, which many plant-based diets are, because omega-6 is in everything, they compete for absorption with omega-3s, and they win. And they can reduce the absorption of omega-3s or reduce the conversion, to EPA and DHA as much as 50%. So there's no set dose of omega-3, but I always recommend between 300 and 500 milligrams a day. But there are studies that have shown up to 1,000 milligrams have benefits as well.
That's amazing. Just hearing you speak, that reiterates the finding things on Google versus going to someone who has done the research and knows what they're talking about. Because back with the iron, I just know there's the levels, but the heme versus non-heme and like having too much, definitely interesting to learn.
Yeah, it's quite complicated, and that's why it's so important to always go to someone who's qualified. And it's a good idea actually at this point to say the difference between a dietitian and a nutritionist. So there are registered nutritionists who are brilliant, and we have one at Plant-Based Health Online. But there are also people who have done a 24-hour course online, and they can call themselves nutritionists because it's not regulated. Whereas as a dietitian, I had to train for 4 years to qualify. And then, of course, you train and you're continuously training and specialising as you go along then as well. So it's really important to go to the right person and check, because you can check the register yourself to make sure they are on there.
That's great. Is the same type of setup in the US and the EU? I believe you're in the UK, so I'm from the US. So everything's registered in those big countries?
Yeah. Yes, it's
Great.
really important to see someone who's registered.
So a lot of people, they switch to a vegan diet, hearing that vegan is better for your health, animals, the environment. The latter two, of course, we'd see that, but there's plant-based and then there's vegan. So is vegan healthy in itself, and what's the difference between vegan and plant-based?
There can be a big difference, and sometimes they're exactly the same. So I consider myself a whole food plant-based vegan because I'm vegan for animals and the environment, and I'm plant-based for health. But I mean, the standard vegan diet, it can be very heavily processed. So there's a huge growing vegan market now, which is brilliant. But unfortunately, a lot of the foods are still high in saturated fat and salt and sugar, and a lot of them contain coconut oil, which has more saturated fat than lard, and it's often seen as a health food, but actually it isn't. It's really quite bad for your health, and has the same effects on your body as other saturated fats. So as a vegan, you can, you're eliminating animal products, which is great. So you're doing at least some benefits to your health, but unfortunately, some swap a processed meat diet for a processed vegan diet, which isn't the best option. So a whole food plant-based diet, on the other hand, eliminates all animal products, but it focuses on whole grains and fruits and vegetables and nuts and seeds and legumes. And all of those foods have been shown time and time again to have the best outcomes for health.
Great. And I remember when I spoke to Dr. Esselstyn, it's some of the forks over knives, where I think might be in his book, he recommends avoiding things like avocados. I'm not sure because of the saturated fat. He probably works with people with heart disease. Are you familiar with along those lines?
Yeah, and I don't follow that advice personally. I think if you have established heart disease, or if you are overweight or obese, then reducing the fat content of your diet is a good idea because it's so energy dense. But I still wouldn't recommend a low fat diet because your body needs fat for so many different functions, and it's especially important for women of reproductive age to have enough predominantly unsaturated fats in their diet, and for most people, because your brain needs unsaturated fats as well. So I always recommend to have a good source of unsaturated fat with most meals for the majority of my patients. So that would be avocados or tahini, nuts and seeds, those kind of things. And some people find that eliminating oil is helpful if they're trying to lose weight because it's very energy dense and doesn't really have any other nutritional value. I don't recommend as a blanket rule to cut out oil because I think that extra virgin olive oil has some health benefits, but it's very much on a one-to-one basis.
So for your industry that you work in, what limitations are there in order to create the ideal world of healthier people, vegan world, plant-based? What restrictions are in place, and what does your industry need in order to grow and impact as many people as possible?
Yeah, it's a difficult one, and as I said earlier, things are changing. So the British Dietetic Association have published their One Blue Dot policy, which looks at the importance of sustainable diets and the important roles that dietitians have to help people make those changes. And they do say in that sustainable diets are going to become part of the curriculum in our degrees. So as I said, when I was there, it wasn't, but I'm hoping that now at least they're starting to introduce those modules in. And they have created a plant-based diet fact sheet as well, which is fairly new. So you can go to the BDA and have a look at all of these fact sheets for free. There are problems in that there are lots of politics involved. So we had a couple of incidents recently. We had a major cancer charity a couple of years ago who were promoting meat-free, and they had to pull their campaign because they were told that funding from the meat and dairy industry would be pulled if they didn't. So they bowed down to that pressure. And also recently a children's program here called Blue Peter, they were promoting meat-free diets for children, and again they pulled that campaign because of pressure from the meat and dairy industry. So it's that side of things, it's really difficult to overcome, but I think as a profession we are definitely realizing the benefits of a more plant-based diet and the health implications of meat, especially red and processed meats.
Great. And this, I didn't put on the questions there, but pretty much like I said, I've been vegan for 4 years. You're plant-based, where sometimes we're in an echo chamber and we hear like, this is the best information. And I always try to challenge my own beliefs just to see outside the box. So people might say, is whole food plant-based the best? And like you said, there's the legislation or the lobbying by the meat and dairy industries. I guess my question is the research. So is there a lot more research being done now that promotes it? And is there anything going against what we promote?
Oh, there's research coming out all the time. And to me, it's, all the research that comes out is conclusive that plant-based diets are the best diet for health. And I mean, in 2015, processed meat was labeled as class 1 carcinogen. And that means that it is cancer causing. It's in the same bracket as cigarettes, yet there are no health warnings on processed meats like there are on cigarettes. So it's people, and many people aren't aware of it. They just don't know. And I think we're failing people and failing their health not to warn them of these risks. And the government should be mandatory that these labels are on processed meats as they are on cigarettes. And at least then you give people might still buy them, but at least you're giving them the choice of whether they buy them or not. But in terms of, as I said, there are just so many benefits of a whole food plant-based diet, and they've been linked to a reduced incidence of many chronic diseases. So you'd be looking at type 2 diabetes, cardiovascular disease, dementia. 13 different types of cancers are associated with poor diets and lifestyle as well. So if everyone follows a whole food plant-based diet, the disease burden would be massively reduced. And actually in the One Blue Dot policy, they're estimating that overweight and obesity, which is increasing every day, that's going to cost the NHS about £9.7 billion a year by 2050. And overweight and obesity are caused by poor diets and poor lifestyle habits. So addressing that would reduce that financial burden, and also the financial burden of the individuals, because if you're ill, you can't go to work, you often don't get paid. There's a huge burden there.
I know in the United States, the health insurance is different than where I'm here in Australia now, in the UK, where the monthly premiums go up because it has to pay for everyone getting sick. I forget who I spoke with. It's not a medical professional, but they are saying how places like China and India, lower income countries, where they start income keeps going up, they eat more meat, eat more dairy, and then they start developing like Western sicknesses like diabetes and things that didn't exist in certain places before. So in my eyes, at least, that's evidence for what we're talking about.
Yeah, it is. And there have been studies that have been shown when diets are swapped as well. So when you take a very unhealthy population and swap them with population that follows a healthy diet, the gut microbiome of the previously healthy participants changes within a very, very short space of time. And the gut is just central to health. If you have a poor gut microbiome and poor diversity in your gut, which is caused by poor diets, it affects every single system in your body. So optimizing that gut microbiome is the most important thing. And the only way you can do that is by eating more fiber from plants.
Is there certain foods you'd recommend more than others? Is like fermented foods like cabbage with probiotics? Is that a big thing? Or
so I don't recommend any one food over another, but I say to include as many different foods as you can, and that includes fermented foods. So I'm a big fan of kimchi and sauerkraut, and they're brilliant additions to have in your diet. I'm also a big fan of sprouting as well. So I sprout broccoli seeds and chickpeas and beans and various things that you can. So I'll sprout anything that you can sprout, and that increases the bioavailability of all of the minerals that are in there and makes the protein more digestible as well. And there are loads of videos on how you can sprout if you haven't done it before.
It's amazing. I've eaten sprouted almonds before. I haven't done it myself, but I purchased them from a little farmer's market in South America, and somehow it's just a better taste. It's not as hard and crunchy. It's more soft and just even tastes better as well.
Yeah, exactly. I'm a massive fan. But I'd say if you are pregnant, that's the only caveat. Or if you have a weakened immune system, then just cook them. Don't eat them raw, because you can introduce bacteria when you're sprouting at home.
Definitely. And kind of wrapping up, I think I asked all the questions I wrote down here, but I'll probably go back to that. But pretty much, where can people go for more information? Let's say they just got diagnosed with high cholesterol, hypertension, diabetes, IBS or something, or even just somebody who wants to eat healthier and they want to get the right information, not from Google.
Yeah, well, it's important, as I said, to, if you're on social media, to follow health professionals who use evidence-based information. Don't follow influencers and personal trainers and people like that who are giving advice who are giving the wrong advice. You can also book an appointment with us at Plant-Based Health Online. So we have doctors and a nutritionist and myself there, and obviously we are all highly trained and qualified. There's also Plant-Based Health Professionals UK, so you can find them at plantbasedhealthprofessionals.com, and they have a range of resources and fact sheets. So I've written a fertility one and co-written a fact sheet on bone health, and there are lots and lots of different resources on there that are really helpful, that are free as well.
Awesome. I'll put the link in the description of the video.
Yeah, that'd be great. And our website's plantbasedhealthonline.com as well.
Okay, so for people who are listening to what you're saying, they might be interested in the career helping others. Like you said, there's Instagram influencers and weightlifters who might not have the depth of knowledge, so they might want a career as a registered dietitian. So what route would they take? What process do they go through? And different things along those lines with career opportunities as well.
Yeah, so when I was training, so you have to have a science A level to start, because it's very anatomical, and there's lots of chemistry and biochemistry in there as well. And I didn't have any of that, so I had to do an access course. So I did that for a year, and then you go into the degree. So when I was studying, it was 4 years, but I think they've reduced it now to 3. So you have 3 clinical placements. So you have the first placement, which is basically just observing and getting involved if you want to, but that's the shortest one. And then you have 2 more clinical placements that you have to pass to then move forward. And when you have your last clinical placement, you have to pretty much be up and running as a band 5 dietitian. So when you qualify, you go in as band 5. So you do general dietetics, and then you specialise and go further up the bands after you've been there for a while. But it's an amazing profession, and I'd highly recommend it. I absolutely love being a dietitian, and we are regulated, so you know that you can trust that what we're saying is the right advice. And as I said, we have to be registered, and we have to have insurance as well to practice.
Definitely. And what types of, I guess, work do they do? Work for a company like yours, in a hospital, and like what other options are there?
So you can either go into the acute setting. So, I mean, when you're training, you have to, and you can do inpatient work. You also do outpatient work, so running clinics for various conditions. And then you decide that you want to specialise. So you can specialise in whatever area that most you have the most interest in. But there are also dietitians that work in the community, in public health. There's lots of different career opportunities in dietetics. You can also be freelance, but I wouldn't recommend you go freelance until you've had at least 5 years experience in the NHS, because when you're freelance, you're on your own. You don't have that support or accountability really as much as you do when you're working with a group of other dietitians, and it can be quite isolating as well. So you need to be completely confident that you know what you're doing when you go freelance. But yeah, you can be a writer as well, go into research, lots of different jobs you can have.
Great. Yeah, I could back up and need the experience first, because when the university, I volunteered as an EMT, and I thought I knew everything when I completed my training. Then I volunteered with all the paramedics and everyone around me, and I just realized I didn't know anything. So getting years experience, definitely good first. And I know you mentioned the fertility, so I guess we'll put a section on that. So when it comes to fertility, how does a plant-based diet help in that area?
Oh, it helps. There's so many different mechanisms. So when you're eating a diet with meat and dairy in it, there can be lots of effects on the body. So, for example, you're having heme iron, which is inflammatory. You're having things called AGEs, so advanced glycation end products, and they're in all animal products, but really high in things like dry cooked meat. So when you barbecue or you grill or you fry meat, that brown layer that forms, that's the ages forming. And what they do is they go into your body, they attach to receptors in your body, and there are receptors around the ovaries and in the womb as well. And if they attach to the ones in the ovaries, they can cause early ovarian aging. And if they attach to the ones in the womb, especially in overweight women, then they can cause this inflammatory cascade and actually stop the embryo from implanting. So by eliminating those foods and focusing on the anti-inflammatory foods that don't cause the inflammation in the body, then all of those things aren't happening. And there are also essential nutrients in the diet that are important for fertility. So things like non-heme iron, zinc, range of vitamins and minerals. And there's data from the Nurses' Health Study too that show that replacing 25 grams of animal protein with 25 grams of plant protein can actually reduce the risk of ovulatory infertility by 50%, which is huge. And also there's data showing that women with lower heme iron intakes and higher non-heme iron intakes have higher levels of fertility. And it's really important to involve the men in the conversation as well, because male factor infertility now accounts for 50% of infertility, which it's increasing over the years. And sperm can be really easily damaged. It's really easily damaged by oxidative stress in the body, which is created by diet and lifestyle. So you're looking at, again, animal products, pollution, and that's outside and also in the home. BPA as well has been known to affect fertility. So there's so much to say about it, but basically the consultation with me would involve looking at the diet in detail, seeing if there are any nutritional deficiencies, and really focusing on reducing the amount of animal products in the diet and preferably eliminating them completely.
Great.
And I've actually just written a fertility update, a clinical update, which is being published this month. It might arrive today, actually, in Dietetics Today magazine. So I'm looking forward to seeing that in print.
Awesome. As soon as you get that, send it to me and I'll include it here.
I will do.
You mentioned plant-based diet helps with this. So is there a general time frame for when people can see results? Is it something they do for 6 months, or does it take longer to clear up? I don't know if that's the right word.
Yeah, so the longer the better, but the really important time is 3 months before you start trying for a baby. So the preconception period, because it takes 3 months for the sperm to develop, around 3 months, and the same for the egg to mature. So a woman is born with all of the eggs she will ever have. So you can't grow more eggs as you can with sperm, but it's during that maturation process that is the important time. So as soon as possible, but within those 3 months before you start trying to conceive is the most important time.
Great. And when the mother is pregnant, during the pregnancy, somebody asked me, is there any research done as far as babies that are born when the mother is on plant-based diet completely, where the traditional thing is probably against it? I don't know if there's any research, or what are your thoughts on that?
Yeah, I think there's a common worry that if you're plant-based and pregnant, your baby's not going to get the nutrients it needs. But again, as long as your diet is well planned and balanced and varies, and you're taking the right supplements, so every woman should take folic acid anyway during the preconception and the first 3 months of pregnancy, and then having good folate intakes throughout pregnancy. And certain requirements increase. So calcium increases from 700 milligrams a day to 1,000 milligrams. But again, that's easily achieved as long as you're having fortified milks and fortified yogurts, and you're having calcium set tofu is a brilliant source of calcium. So you've got about 350 milligrams in 100 grams of calcium set tofu. So that's a good chunk towards your needs. And yeah, as long as you're having all of those, a balanced diet, then you're not going to put your baby at risk of nutritional deficiency. And actually, there's something that happens during pregnancy called fetal programming. And if the mother is overweight and following a less healthy diet, that can permanently alter the metabolism of the child and put them more at risk of chronic disease when they're older. So following a healthy, balanced, whole food, plant-based diet is not just good for yourself as a mother, but also for your developing baby.
Great. And earlier in the interview, whether it's with fertility, IBS, or general health, you mentioned there's an approach. It's not just about the diet. There's also other things. You said the word pollution that triggered in my mind before. So lifestyle, environmental, what other factors do you do with your work?
So all of those pillars of lifestyle medicine. So stress is a major contributor to a lot of problems, and especially gastro problems as well. And if you're stressed, your IBS will get worse, your inflammatory bowel disease might flare up. And there have been a big increase in flare-ups over lockdown, for example, because it's been such a stressful time. And the same with fertility. Stress can really impact fertility. So I very much focus on stress management with my patients and sharing my own personal stories as well, because I found, having gone through IVF myself and having experienced infertility, I know how stressful it is. I know how it can impact on your relationship as well. And especially when you're going through treatment, your hormone levels are all over the place. You can be calm one minute and turn into this raging, crazy person the next minute. So techniques I found really helpful when I was going through it was laughter therapy. So finding something that makes you laugh. So either a comedian or watching Friends or something on television that just makes you laugh. You can't be anxious and stressed when you're laughing. So I think that's a really important thing you can do. And also meditation and breathing exercises. And there are lots of channels on YouTube. So there's one called The Honest Guys that I always recommend. And they take you through kind of small guided meditations. And anything you can do to just reduce those stress levels. Positive visualization is another really helpful technique. So we discuss all of those things during the consult. So it's certainly not just diet focused.
Great. Yeah, I think I listened to the Honest Guys. They have like a candle meditation one that I listened to. And remember when I was many years ago, I was building a business and then I was facing a lot of struggles and I had stress. And I learned a thing called the emotional freedom technique. Not sure if you heard of that, but like you tap certain meridian points while you focus on stress. And it just, you could go from 10 out of 10 to 0 really quickly. And that's personally something that really helped me. So
yeah, anything like that is beneficial. And meditation is one of the most evidence-based methods of relaxation as well. It can reduce your blood pressure and just really reduce overall anxiety.
okay, so you're doing all this work, obviously, to solve problems in the world. So what would the world look like when your work is done and everyone is exactly how you want it to be?
That would be a very different world, wouldn't it?
Mm-hmm.
So what it looks like now. I think all we can do is spread, the message as widely as we can, give the education, give the evidence-based information, and at the end of the day, people will do what they want to do. But at least if they're informed and they know, they have the right choices, then I think a lot of people would want to follow that route. And we've had so many patients come through on plant-based health online who were not plant-based when they came to us, but are now completely whole food plant-based, and they've noticed huge improvements in their health. Their blood pressures have reduced significantly, their cholesterol has come down. We've had patients who have put their type 2 diabetes into remission with a plant-based diet, because the main risk factor for type 2 diabetes is being overweight and obese. And when that happens, your insulin can't get into the cells properly to control your blood glucose levels, and you end up with type 2 diabetes. So weight loss is absolutely key. And people will say that they've been on diets on and off for 20 years and nothing's ever worked. They've lost weight, they've regained it, they've lost weight, they've yo-yoed and not felt particularly brilliant on those diets. and they've started a whole food plant-based way of eating, and without even thinking about it, the weight's come off and it stayed off because they enjoy that way of eating. They don't feel that they're restricted, and they don't feel that they're denying themselves anything. So I think whoever you come across, who plant-based health professionals or anyone who follows a plant-based diet, they are so passionate about what they do and how they educate, and that's all we can do, is just keep going and hope that at some point that message gets across to as many people as possible.